Originally in Canada, I was a therapist. So I worked as an occupational therapist with mental health for 7 years and loved it, did really good. But my path was more of a spiritual path. I think coming from the traditional medical model, you see it played out, and you can have good, successful outcomes, but at the same time, there's challenging cases. My last rotation in one of the hospitals was with child adolescent psychiatrist in inpatient ward, and it just tore me apart. These kids just needed almost everything from love, hope, medication, stabilization, and that's where I fit in. I've seen it in my personal life. I've seen it in my children's life. My daughter has autism. My son has ADHD. So it's more impactful, it's more meaningful to me, it's more of a mission. I'm here to make a difference, and I'm here to make it with Amen Clinics. There's treatment elements or even diagnostic elements that you wish you could have done, and the Amen Clinics does that. So helping transform my life has been impactful. At the same time, it redefines my purpose. Psychiatry is the last frontier, and it's invigorating as a professional when you know you can use imaging, nutraceuticals, therapy, and all these unique approaches to help the patient. So it's one of the fields that I think can still continue to expand, and we can continue to have good outcomes for patients. I love the fact we say brain health. We stay brain health, we drop the stigmatism, and everyone strives for a healthy, restorative brain with lots of reserve. Generally, people don't think about it. They can see a physical injury, but they can't see an insult on the brain. So if you look at traumatic brain injuries, yeah, there's the big ones, but what about the little ones? The little ones that hurt the brain, that you don't have any symptoms. So just as in a personal example, I was a child in England. I just started walking, and I became anoxic, and I turned blue, and I collapsed. And I was put in, the bubble, raised by nuns in England for a while. So, nowadays, we probably would have done a spec study on me and probably got me started with some hyperbaric oxygen chambers, some nutrients to protect my brain. That wasn't offered then. Even as a therapist in Canada, we talk about a holistic approach, but no one practices it. We talk about it, but we don't. We get stuck with volumes, and we just push people in and out of the system without actually treating them. Amen's model, holistic. Time spent with the patient. We come with a collaborative treatment plan where they're engaged, motivate their treatment plan, and provide them the tools to succeed.